Immunotherapy has been a big thing. I think every meeting we keep having more drugs approved. We've had 2 bispecific T-cell engagers approved in the month of August. We have 2 CAR T-cells approved and 3 bispecifics. So this was looking at practical aspects of the use of these T-cell directed therapies. We started off with sort of just highlighting some of the newer data. So with CAR T-cells and the bispecifics, how can we move them in earlier lines of treatment? Dr. Adam Cohen talked about that. We next went into sort of toxicities associated with this, acute toxicities, which we typically see in the hospital setting. We spent a little bit of time talking about what the right sequencing should be or combinations should be. And finally, the didactic talks were related to supportive care, infection, which I think is a big part of how we use these T-cell directed therapies. I think what was really exciting about the session we had also was 3 really good oral presentations, all sort of related to T-cell directed treatments. One from China was about how to manufacture CARs quickly, so a 3-day manufacturing, because one of the biggest limitations of CAR T-cell therapy is access and waiting the 4 to 6 weeks to get those CARs. So that was a real good abstract. The second abstract was the use of imaging on trying to prognosticate and better stratify patients with respect to response. And this was a Spanish study coming from the University of Navarro, where they looked at FDG PET scans at baseline. And I think what we learned, the biggest takeaway for me from that trial was that don't do a PET scan too early. So a month 1 PET scan is not of any use, but doing the month 3 does actually correspond to not just progression-free survival, but overall survival as well. And then we had a wonderful panel discussion with really good people, excellent questions, and we can dig a little bit deeper into those if you'd like.